So, till now you have been studying face, then triangles. Now we are going deeper into the triangles. Like deeper in the muscular triangle is a gland called thyroid gland. Thyroid gland is your long question. Thyroid gland is your MCQ. Thyroid gland is your short question. Something on thyroid gland. You cannot pass first MBBS, second MBBS, third MBBS and PG NEET without thyroid gland. Yeah. Now this thyroid gland, let us talk about its development first. Thyroid gland develops from the pharyngeal arches. Now before that, let me tell you what happens to the pharyngeal arches. Now this is the upper part of the foregut. Upper part of the foregut. Now suddenly in the upper part of the foregut, arches, pharyngeal arches develop. So in this, 1, 2, 3, 4, 5, 6. Arches develop like this. Okay? जैसे हम लोग को डबल चिन होता है ना, वैसे हम लोग 6 चिन्स ऐसे अपर पार्ट 1, 2, 3, 4, 5, 6. जब हम बाहर से देखते हैं तो दिस इज वन आर्च, दिस इज वन क्लेफ्ट, दिस इज सेकेंड आर्च क्लेफ्ट, फर्स्ट क्लेफ्ट, सेकेंड क्लेफ्ट, थर्ड क्लेफ्ट, फोर्थ क्लेफ्ट, फिफ्थ क्लेफ्ट, सिक्स्थ क्लेफ्ट. Now if I take a coronal section, this is one arch, this is one arch, this is a cleft, second arch, then third arch. Okay, I'm not drawing everything. So this is the cleft. You understood? Bronchial cleft, pharyngeal cleft. But similar thing develops from the inner side. This is the gut cavity, ये gut cavity. So what is this? This is called as pouch. Okay? Arch, pouch, cleft. You understood? Pharyngeal arch, pharyngeal cleft, which is on the external aspect. So this is called ectodermal cleft. Because ectoderm will be here. Endoderm will be here. So this is called as endodermal pouch. This is ectodermal cleft. And what is this? This is the arch. Mesodermal arch. So ये arch से क्या develop हो जाएगा? Muscles, then bones, cartilage. Each arch muscles will have their nerve. Each arch will have its artery. So all these details we'll study in the pharyngeal arches. Today we are concentrating only on the first arch. So now this is the first arch, and second arch. So in the first arch develop lingual swellings from where the tongue is developed. Lingual swellings from where the tongue is developed. Then there is a structure called as tuberculum impar. Tuberculum impar, which also contributes, one more swelling contributes to the tongue. Tuberculum impar. And then here, caudal to the tuberculum impar. Caudal because now this is first arch, this is second arch. That develops a foramen. Oi, midnight cycling. Struggle mat kar itna. So that caudal to that is foramen cecum. One more foramen cecum in the body. So Varun, hey Karuna, pause kar. So develops a foramen cecum, endodermal. This foramen cecum goes down. From this foramen cecum goes down a thyroid diverticulum. एक foramen आया, जमीन में जब बोरवेल बनाते हैं तो पहले एक होल बनाते हैं, फिर नीचे जाते हैं। वही होल नीचे गया up to the neck, and in the neck it forms the thyroid gland. On both sides there is swelling, and then some lateral thyroid develop from fourth and fifth arch may contribute. Lateral arch, ultimobronchial body, they may contribute. But main is from, now this diverticulum is called thyroid diverticulum. Thyroid diverticulum. This eventually disappears. Okay, this eventually disappears. It is also called as thyroglossal duct. Now understand why thyroglossal duct. Tongue is developing from here. Thyroid is developing from here. A duct. करण के बाजू वाला लड़का आंख बंद करके सामने वाले का शील्ड लेके तो मेरे लेक्चर में ऐसा सोएगा, कैसा चलेगा? खड़े रहे तो खड़े रहे, खड़े खड़े नींद नहीं आती. तो दिस duct is what? Which duct? Thyroglossal duct, because tongue is developing here thyroid. This thyroglossal duct will disappear. If it does not disappear, persistent thyroglossal duct, the thyroid will be connected to the tongue. So any thyroid swelling, you tell the patient to move the tongue out. Swelling will move. Swelling moving with the protrusion of tongue means that is thyroglossal cyst. Sometimes it may get disconnected from thyroid and may persist somewhere in between. वहाँ पे cyst develop हो गया. तो कैसे पता चलेगा ये goiter है? Goiter moves up and down with larynx. Thyroglossal ये भी up and down move with deglutition. But thyroid swelling normally does not move up and down with protrusion of tongue. This will move with protrusion of tongue. That is thyroglossal cyst. Now this sometimes remains as a pyramidal lobe in between. Pyramidal lobe in between. थोड़ा सा उसका part में form the pyramidal lobe. Otherwise it disappears. If it does not disappear and towards the end there is a cyst formation detached from the thyroid, that cyst is called as thyroglossal cyst. This cyst moves up and down with protrusion of tongue. Thyroid swelling moves up and down with deglutition. So this is about the development of thyroid. Now let's go to morphology of thyroid. Thyroid is in the neck. It extends from C5 to T1, T1, T2, C5. Because we said internal common carotid divides at the upper border of thyroid cartilage. And that level is C4, disc of C4. That means thyroid will start from C5. Thyroid extends up to the second or third tracheal ring of the larynx. Larynx and pharynx, both of them start at the level of C6. C6. So ये thyroid cartilage है, ये जो मैं अभी ड्रॉ कर रहा हूँ, ये thyroid cartilage है. This is thyroid cartilage. On this thyroid cartilage is an oblique line of thyroid cartilage. And here is the thyroid gland. Now below thyroid is cricoid, and below cricoid the trachea starts. So this is cricoid, this is thyroid. Okay? This is thyroid, this is cricoid. Below cricoid, what starts? Trachea. So this level is C6. Thyroid doesn't end at thyroid cartilage level or cricoid gland. It goes to second tracheal ring, and therefore the level of thyroid is T1. Level of thyroid is T1. Now I am drawing thyroid with a different chalk so that you are not confused with thyroid cartilage and thyroid gland. Okay, thyroid cartilage and thyroid gland, there is no confusion. So cartilage is here. It's like a shield shape. Thyroid gland. Okay, thyroid gland. Shalva, sorry.
1, 2, 3, start.
Now when we ask the shape of the thyroid gland, the shape of the thyroid gland, when we ask studious students, they say H-shaped. H-shaped. जो रट्टा मारने वाले बचपन से रैंक वन रैंक वन रैंक वन रैंक वन रैंक वन रैंक वन, तो क्या बोलेंगे? H-shaped. बट कुछ लोग ऐसे रहते जो नेचर लवर, तो जाके पढ़ेंगे संजय गांधी नेशनल पार्क का कौन सा केव्स था, कनेरी केव्स, ऐसे उधर जाके बायोलॉजी पढ़ रहे हैं, नीट का पढ़ाई कर रहे हैं. उनको अगर पूछेंगे कि व्हाट इज द शेप ऑफ थायराइड, वो बोलेंगे बटरफ्लाई शेप. बटरफ्लाई शेप. सो थायराइड ग्लैंड के शेप इज एच शेप और बटरफ्लाई शेप. आप एग्जाम में क्या लिखोगे, जैसा आपको थायराइड दिखेगा. कितने लोगों को इधर बटरफ्लाई दिख रहा है? जबरदस्ती. मुझे तो एच दिख रहा है, बंद कर. H shape. Okay, so this is, there are two lobes and one isthmus. Two lobes connected by one isthmus. Isthmus. यही अगर हम कट सेक्शन में देखेंगे, यही अगर हम कट सेक्शन में देखेंगे, so this it goes all around. ये ऐसा नहीं है, वो ऐसा जाता है पीछे. ओके, यहाँ पे है ट्रकिया, यहाँ पे है इसोफेगस. ट्रकिया इसोफेगस, सो अराउंड द ट्रकिया इट गोज लाइक दिस. मैंने जरा ज्यादा गैप छोड़ा है, एग्जाम में आपको थोड़ा सा ट्रकिया बड़ा दिखाना पड़ेगा. Between trachea and esophagus runs a nerve called as recurrent laryngeal nerve. Recurrent laryngeal nerve. So this is isthmus, this is the lobe. Okay, now let's go here. So this side I have written vertebral levels. This side I have written vertebral levels. C5, C6. Okay. Now isthmus lies against second and first and second tracheal ring. Now I am writing about, not about. बस रे खाली बस. काय नाव तुझं? गौरव. Now I am not writing about vertebral level. I am writing about levels as per thyroid cartilage. Anterior, this thing. It extends from oblique line of thyroid cartilage. It extends from oblique line of thyroid cartilage to the lobe. The lobe. Lobe extends up to the fourth or fifth tracheal ring. यहाँ पे rings आएंगे ट्रकिया के. Fourth or fifth tracheal ring. Tracheal ring. Isthmus lies against first or second tracheal ring. जरा pause करें. So now you see the surfaces of the lobes. Medial surface, lateral surface, posterolateral surface. What are the three surfaces? Medial surface, lateral surface, posterolateral surface. Let us see the borders. Let us see border 2. Border. कितने लोगों ने border 1 देखा है? जवानों, चलो border 1. Border. So this is border 1. एंटीरियर बॉर्डर, दिस इज बॉर्डर 2. ऐसे लिखने का नहीं एग्जाम में, एंटीरियर बॉर्डर एंड पोस्टीरियर बॉर्डर, एंटीरियर बॉर्डर एंड पोस्टीरियर बॉर्डर. ओके, सो वन मोर डायग्राम. तो ये डायग्राम तो आपने अभी देखा है ऑलरेडी. वन मोर डायग्राम फ्रॉम द साइड, दिस इज लोब फ्रॉम द साइड, साइड से देख रहे, लोब फ्रॉम द साइड. कौन सा कितना बॉर्डर है? एंटीरियर नहीं बोलेगा, क्या बोलेगा? बॉर्डर 1 एंड बॉर्डर 2. नार्वेकर बघितला का तुम्ही? बॉर्डर 1 काय देशभक्ती वगैरे काय करा काय तुम्ही? हां, जयंत नार्वेकरांसारखं फक्त रिसर्चच करायचं. बॉर्डर 1 एंड बॉर्डर 2, anterior border. Now the superior thyroid artery, which is a branch of external, internal. काय बोलीस? काय बोली? काय? Internal carotid artery does not give a branch in the neck. External carotid artery वो स्पेशल है, वो अंदर जाते. एक फर्स्ट ब्रांच ऑफ एक्सटर्नल. तुम्हाला काय, तुम्ही होता का लेक्चर मागच्या? तुम्ही व्हिडिओ बघण्याचा प्रयत्न केला का? नाही, काहीच नाही. Now this superior thyroid artery comes here and divides into anterior branch and posterior branch. Anterior branch and posterior. So अपने को border 1 related to anterior branch, border 2 related to posterior branch. ये डायग्राम में निकलता हूँ. Border 1 anterior branch, posterior branch. हाँ? ये थायराइड ऐसा कभी नहीं दिखता, इसको सीधा किया है मैंने, ऐसा रहता है, उसको सीधा किया, उसके बाद ऐसा. Now inferior thyroid artery, which is a branch of thyrocervical trunk. Thyrocervical trunk is a branch of subclavian. So this is posterior thyroid artery. तो posterior border में क्या होता है? Anastomosis between posterior branch of superior thyroid and inferior thyroid. Okay? So ये clear हो गया. Now let us talk about the relation of the lateral surface. Relation of the lateral surface of the lobe, सबसे आगे, covering everything, sternocleidomastoid, then sternohyoid, then omohyoid. Omohyoid का you have to write which belly? Superior, and sternothyroid. Okay, this is clear. Sternocleidomastoid, sternohyoid, omohyoid, sternothyroid. This is clear. Lateral surface. Posterolateral surface. Posterolateral surface. PL. Posterolateral surface is related to carotid sheet. Carotid sheet. What is there inside the carotid sheet? Internal carotid artery. Then internal jugular vein and lower 4 nerves, but vagus. We say vagus. Okay, so posterior lateral surface clear. Now coming to medial surface. Medial surface classically described in your textbook. It is related to 2 tubes, trachea, esophagus. Trachea and esophagus. It is related to 2 muscles. 2 muscles which arise from. तुम्हारा नाम क्या है? नार्वेकरच्या मागे बसलेला मुलगा. हाँ, फैजल. फैजल, what is this line? Oblique line of thyroid cartilage. जो sternothyroid होता है ना, sternothyroid. So this is oblique line of thyroid cartilage. The sternothyroid muscle will come like this and get inserted here. On what? Oblique line from above. And it packs the upper end of thyroid. And that is one reason thyroid swellings can never go up, because sternothyroid is attached here. Therefore, thyroid swellings hang down in the neck. So whenever there is a thyroid swelling, you will not see a thyroid swelling going up because of sternothyroid. It will hang inferior. Okay, thank you. कळलं? अरे शाल्व तू यू आर स्टिल स्ट्रगलिंग विथ थांबू का तुझ्यासाठी 5 मिनिट
होईल सर.
पॉज कर दिस इज थायरॉइड कार्टिलेज नॉट थायरॉइड ग्लैंड थायरॉइड ग्लैंड विल बी लाइक दिस ऑन दिस थायरॉइड ग्लैंड विल बी लाइक दिस इज थायरॉइड कार्टिलेज थायरॉइड ग्लैंड को मैं दूसरे रंग में दिखाता हूँ. अभी ये डायग्राम ड्रॉ करने का प्रयास मत करो, 2 मिनट मैं आपको पॉज करके टाइम देता हूँ इसके लिए. दिस इज यू आर लुकिंग फ्रॉम द साइड, दिस इज द थायरॉइड कार्टिलेज, दिस इज द ऑब्लिक लाइन. फैजल, दिस इज द ऑब्लिक लाइन. हमने ऊपर से देखा कि sternothyroid, अभी sternothyroid निकाला, thyroid gland निकाला. So then we see that from the oblique line taking origin is inferior constrictor muscle. Inferior constrictor muscle. Then from the thyroid to cricoid runs a muscle called as cricothyroid, which is of the larynx. So these are the two muscles. फिर thyroid gland इधर है, उसको निकाला. So that means medial surface. इसको निकाला मतलब which surface are related to these two muscles? Medial surface. So medial surface is related to two tubes. This is clear to you? Two tubes, two muscles. What are those two muscles? Inferior constrictor and cricothyroid. And two nerves. So supplying this cricothyroid is external laryngeal nerve. Oh, what is external laryngeal? तो लिखती है सर. What is the external laryngeal nerve? It is branch of superior laryngeal nerve. Superior laryngeal divides into internal laryngeal and external laryngeal. मतलब वेगस के नेक में 2 ब्रांचेस है, सुपीरियर लैरेंजियल, रिकरेंट लैरेंजियल. रिकरेंट लैरेंजियल एक साइड का थोरैक्स में रहता है, लेफ्ट साइड का, राइट साइड का नेक में रहता है. अपन बाद में डिस्कस करेंगे. 2 लैरेंजियल ब्रांचेस, सुपीरियर लैरेंजियल एंड रिकरेंट लैरेंजियल. So superior divides into external and internal. Internal pierces thyroid membrane and is sensory to the lower part. Is sensory to the larynx, sensory to the lower part of pharynx, lower upper part of larynx, upper part of larynx, lower part of pharynx. थोड़ा सा मतलब. Okay, so I'll draw for this again and you can draw with me. So this is thyroid cartilage. This is oblique line. From this oblique line is taking origin is inferior constrictor. This is cricoid. This is cricoid and this is cricothyroid muscle. This is superior laryngeal divided into internal and external, external supplying this. So 2 nerves are recurrent laryngeal and external laryngeal. Okay, draw this. Pause. Now let us talk about the relations of the isthmus. Anteriorly isthmus will be related to sternothyroid. बरोबर? थोड़ा sternocleidomastoid. Posteriorly it will be related to the second and third tracheal ring. Second and third tracheal ring. मैंने first and second बोला था गलती से. Second and third tracheal ring. हाँ? चेक करो आपके बुक में क्या लिखा है. कुछ बुक्स 1 2 बोलते हैं, कोई बोलते हैं 2 3. Isthmus posterior relation.
Second to fourth.
second to third trickle
Second
tube.
to fourth.
हाँ
Second to fourth.
सेकंड टू फोर्थ. ओके, ठीक है. नाउ isthmus superior border. पृथ्वीराज, superior border of isthmus is related to anastomosis between the anterior branches of superior thyroid artery. Very good. And inferior border is related to middle thyroid vein. Middle thyroid vein. Inferior border of isthmus related to middle thyroid vein. Welcome to head neck phase. ऐसा ही है पूरा. ओके. स्नेहल उशीर झाला आता, काय करू शकत नाही. Blood supply of the thyroid gland is from superior thyroid artery, which is branch of external thyroid gland. Inferior thyroid artery, branch of thyrocervical trunk of subclavian. So again, here some anastomosis is happening, but anastomosis is happening between external and subclavian. गठबंधन हो रहा, दो अलग अलग आर्टरीज का. हाँ, ठाण्यामध्ये काय तुमचं गठबंधन? क्लिअर कट मेजॉरिटी. ओके. त्यानंतर व्हीनस ड्रेनेज बाय सुपिरियर थायरॉइड वेन, मिडल थायरॉइड वेन, इन्फिरियर थायरॉइड वेन. lymphatic drainage to deep cervical lymph nodes. Deep cervical lymph nodes. Then comes the applied anatomy. Start setting up for Vivek sir. Setup start करो ये चालू. सर अपना ला रहे क्या ये? नहीं वही उसमें चालू तो करो. चालू है. चालू करो, वो चालू करो. मैं कुछ बोल रहा हूँ, ऑनर तो करो, मैं भी बोल रहा हूँ. एक जन विवेक सर को मैसेज करो, आ जाओ करके. हाँ, राहुल कर रहा है. Applied anatomy. Applied anatomy has to be written under 5 headings. What are those 5 headings? सप्रे. पहिलं नाव काय सप्रे तुमचं? रचना. सॉरी. काय फर्स्ट is always congenital anomalies. तिला चालू कर. So applied anatomy has to be written under 5 headings, and now we are discussing applied anatomy of thyroid. 1. Congenital anomalies. So congenital anomalies of the thyroid gland, थोडंस असं वळव इकडे. Because thyroid gland comes down from here, somewhere between only it may stop. So that will cause ectopic thyroid. It may be in the tongue. Suddenly tongue में thyroid tissue. It may be any place between tongue and neck. Or it may go to thorax. आगे ectopic thyroid. Then thyroglossal cyst from the persistent thyroglossal duct. It will move with the movement of tongue. Okay. Second applied anatomy is investigations. Investigation of thyroid T3, T4, thyroid scan. Okay. Investigation T3, T4, thyroid scan. Then medical problems. Thyroiditis, inflammation of the thyroid. Surgical problem. त्याचं टेन्शन नको घेऊ, ते सोड. Thyroidectomy. Okay, never we do thyroidectomy. 2 cares have to be taken. 1, posterior strip has to be kept if it is not a cancer, so that some minimal thyroid production happens and parathyroids are preserved. They lie along the posterior border. One more relation of posterior border of the lobes. Parathyroidism. Another thing, during thyroidectomy, ये जो external laryngeal nerve है, that always has to be ligated near. Sorry. So this is superior thyroid artery. So external laryngeal nerve is somewhere here, in close relation to this artery. So this artery has to be ligated near the gland. recurrent laryngeal nerve is very close here. So inferior thyroid artery has to be ligated away from the gland. Superior thyroid artery has to be ligated near the gland because it is related to external. And last is thyroid cancer. बंद कर. परत चालू कर. Now I am going to talk about this one question which will be asked to you in third year also. This is superior thyroid artery. It is in close relation with external laryngeal nerve. But it is in close relation with external laryngeal nerve away from the gland. So therefore, superior thyroid artery is ligated during thyroidectomy near the gland. Superior thyroid artery to be ligated near the gland. But as regards inferior thyroid artery, it is very close relation with the recurrent laryngeal nerve near the gland, and therefore it has to be ligated away from the gland. Again repeat, superior thyroid artery to be ligated near the gland. Recurrent and inferior thyroid artery to be ligated. Now what happens if I ligate here? Galti se. This I ligate away from. I will ligate the external laryngeal also. It supplies this muscle, cricothyroid. Cricothyroid is just responsible for pitch of the voice. Otherwise, person will keep on talking. No issues, even in spite of. But if that person is a singer, he will not be able to go high pitch. So one singer suffered from this. She was operated by a surgeon who had gone for midnight cycling on the day when thyroid lecture was taken. And he missed this point and he ligated the superior thyroid artery away from the gland and ligated external laryngeal. And then after the operation, she was speaking. So surgeon said, it's successful. And then when she went for her show, high pitch was, high pitch. लता मंगेशकर मेरे वतन के लोगों, वो जो करते हैं अपने को नहीं जमते वो. That is high pitch. Sachin sir को जमते. That is म्हणून रियाज. Why? What is रियाज? Riyaz is you develop this muscle properly, cricothyroid muscle. So the person will lose pitch of the voice if you are not careful. और नीचे का जो है recurrent laryngeal and inferior thyroid, this has to be ligated away from the gland, close the gland. Recurrent laryngeal को ये कहते तो आधा laryngeal muscles, except for this muscle, all are sort of. Then that the person may not be able to talk and breathing will be also difficult. Okay, so be careful while thyroid surgery. Midnight cycling करो, but दूसरे का आवाज मत बंद करो. उसके लिए लेक्चर को आना बहुत जरूरी. थैंक यू. 9:14 हो गए. सबको बोलो. थांब जरासा. Till that point sir comes, thyroid has a true capsule and a false capsule. True capsule is made up of tissue of the thyroid only, just condensed around the gland. False capsule is made by, क्या बात है, pretracheal fascia. काय नाव तुझं? मृणाली. Pretracheal fascia. Okay, this pretracheal fascia attaches the thyroid to the thyroid cartilage and larynx, and therefore thyroid swelling moves with the larynx at every deglutition. Person comes with a thyroid swelling, उसको बोलते swallow करो, फिर बोलते टंग बाहर निकाल. टंग बाहर निकालने के बाद भी हिल रहा है, मतलब it is thyroglossal cyst. The thyroglossal cyst will also move with deglutition. Okay, so true capsule, false capsule, and below the false capsule is the blood vessel. Okay, below the false capsule is the blood vessel. In case of prostate also there is true capsule, false capsule, but between them are the blood vessels. So during operation of prostate, what they do is, I'll show you. In prostate there is true capsule, false capsule, and in between are blood vessels. और प्रोस्टेट यहाँ पे. So they take out the prostate. That is called enucleation. They take out the prostates because इधर किधर भी कट मारा तो bleeding होगा. So leave the true and false capsule like that only. Okay. In thyroid, what is there is true capsule, false capsule, and then there are blood vessels. So you cannot remove. You can only remove the true capsule. Thyroid has to remove along with the false capsule. Sorry, along with the true capsule. Outside is false capsule. This is true capsule, this is false capsule. Outside is false capsule. Okay, so I'll repeat again. True capsule, false capsule. True capsule, false capsule. So thyroid, stand up. Sir, तुम्ही लावा. So तुम्ही सोडू का? बसा खाली. त्यांना ब्रेक द्यायची काही गरज नाही. मिडनाईट सायकलिंग करून आले.
ऑलरेडी ब्रेक मध्येच आहे.
हो, ब्रेक. हां. आलं का लक्षात इकडे काय म्हणतो मी? Prostate has to be removed, leaving the true and false capsule behind because between both of them is blood sinuses. Thyroid has to be removed along with the true capsule. False capsule can be left behind because you cannot remove the true capsule. There are blood vessels. Thank you.